John Hook's Newsmaker starts now.
Thanks for joining us on Newsmaker. In the 100 some odd days since Donald Trump's election, the border crisis has seemingly all but vanished. And for Arizona, the implications could not be greater. Ross Teeple is the sheriff of Pinal County. That is Arizona's third most populous county, 425,000 residents, covering 5,000 square miles, sandwiched smack dab between Phoenix and Tucson. Sheriff Teeple joins me now on Newsmaker. Great to see you. I am so curious about the border situation now. You guys have really been kind of a gateway as people come across the border. They end up traversing through Pinal County. What is the situation there now, Sheriff?
A difference between night and day, John, and thanks for having me on, sir.
You're
really
welcome.
Appreciate the opportunity to get the information out there, but it is just so great to have a president that actually cares about border security. We went from just a free flood of individuals crossing the border because they knew they could get away with it to it is stopped down to a bottleneck now. They're changing their tactics, but it's definitely night and day improvement.
So you were dealing with not only narcotics trafficking, but you were dealing with human trafficking. Your predecessor said you guys were kind of stretched to the limit at the height of this back in 2022, 23, into 24. Tell me now what's happening. Are you having interdictions, or is it rare?
It's more rare. They're changing their tactics to say the pre-Obama era tactics, where they're smuggling now at more remote areas. They're hiding among commercial vehicles. One thing that I am very grateful for, because I got into law enforcement over 30 years ago to protect the children, because they are the only true victims. And I will tell you that the border was so porous before that the cartels started to shift their business model, because that's what they are, is a terrorist business model, started shifting it from drug smuggling to human trafficking, because you could only sell a fentanyl pill one time. You could sell a child over and over again to these just completely evil people. And as far as the human smuggling of minors, that is all but just dropped off. And
that's incredible, because we were repeatedly told that this was just kind of the new normal, that the border's secure. I mean, in a matter of weeks, this stopped, virtually stopped.
Isn't it amazing that you had a president that took over and rescinded a whole bunch of executive orders and then said, well, we need a constitutional amendment to stop the border? No, you just need to reinstate those executive orders. But they kept saying, no, we need a new law passed, we need new legislation, and we get a new president's elected, and almost overnight it stops.
So how much pressure, Sheriff, has this taken off of your county to not have to deal with that?
The manpower pressure has been greatly reduced, because now our deputies can get back to concentrating on their law enforcement functions that aren't directly related to the border. I can tell you, when I started with the Pinal County Sheriff's Office, we would have a pursuit that was directly related to a border incursion maybe once a month. At the height of the Biden era, we were having 2-3 a day. Now we've gone back to where they still occur, because there's still nefarious actors out there in the bringing the drugs across. But now the pursuits are less, the chases are less, the incursions into neighborhoods are less by just an astronomical amount.
How about people in the jails who are from other countries? Are you seeing that now, or has that dried up?
It's dried up, yes.
This is remarkable. Back in 2023, Governor Hobbs, at the height of this, she at least recognized that there was a big problem and that there was a strain on local counties. You guys got $3.2 million to fund your county to combat human trafficking and drug smuggling, what we just talked about. Where did that money end up going, and what now?
Well, a lot of it still occurs, because Pinal County is unique in one thing that a lot of people that aren't from this area don't realize, but there is a tribal nation called the Tohono O'odham Nation. They are one of the few dependent sovereign nations that crosses the international border. Well, you have to understand that it doesn't matter who the president is or who the governor is that the people in the Tohono O'odham Nation are being victimized by the cartels. So we immediately, when we took the money, we use that for resources to put weight trackers in and cameras up. So when the cartels are victimizing the people of the Tohono O'odham Nation and crossing their border, we're getting notification as soon as they're leaving tribal land and they're offloading their drugs and their supplies on Interstate 8. It's why Pinal County becomes called quite a bit the illegal
corridor.
Highway.
Yeah,
Yep.
yeah, the corridor. So that is still happening on the Tohono O'odham Nation right now, even with everything that President Trump has done.
That's where they're shifting back to now. It's as far as the Tohono O'odham Nation, it's a very remote nation. There's individuals that there are not very many places there that it's easy to cross. So that's why under the previous administration, they knew they could just walk across the border anywhere. I-10 became the drug corridor. It became the smuggling corridor because they were just driving up from the Tucson sector because they could cross anywhere. Now that Border Patrol is actually being allowed to do their jobs and be on the border and not making sandwiches for fake asylum seekers, now Border Patrol is actually patrolling their area, which is forcing the cartels to go back to their old ways of re-victimizing the Tohono O'odham Nation and bringing the majority of their drugs through that
So they're
area.
being pushed into tougher and tougher areas to cross.
Yes.
Got it.
And that's going to become more and more obvious the hotter it gets.
Okay. Voters, as you know, passed Proposition 314, the Secure the Border Act, which created state crimes for illegal immigration. How is that working out on the ground?
For Pinal County, we don't really have a direct impact with that because the law is great, and I appreciate the voters giving us another tool in the toolbox. But where it gets miscategorized is they called it like we can stop anyone and say, if you're not in the country illegally, we can now charge you under this. What we have to do is there has to be a nexus where we can conclusively show indications that they just recently.
Yeah, you need to see it. You need to witness it.
That's exactly
okay. Right. So in Pinal County, you're not witnessing a border crossing. You're getting it after the fact.
Yes, sir. We're getting someone leaving after they've already crossed the border and crossed another county.
I don't know about your county attorney, but there were some county attorneys around the state who opposed that law vigorously, even Republicans. They thought it was overreach. They didn't think it was constitutional. They didn't like it. How are you guys in Pinal County with agreement between, we've heard this around the country. Arrests are made. DAs may have a different idea about how they want to handle things. Are you guys kind of on the same page on this?
Well, Pinal County elected a Republican sheriff and a Republican county attorney, so it's easy to do the math there.
Okay. You had a deadly officer-involved shooting in Santan Valley Wednesday. No officers injured. Apparently a call involving domestic disturbance. This is one of the most dangerous calls you go on.
Yes.
What's the upshot of that? Can you give us an update?
Update of it is right now is the deputy is on mandatory admin leave. We do this so they can decompress, they can get contact with their families.
That's standard.
Yes, sir. That's absolutely standard. We do it for every single one of our employees because no deputy that works for the Pinal County Sheriff's Office wakes up in the morning and wants to have to take someone's life. Deputies want to serve and protect, and they want to protect the community. They realize that someday the end result of protecting one member of the community is having to use deadly force on another member of the community, but that weighs on every individual differently. So it's mandatory that we put them on standard admin leave so they can get the resources that they need to return back to work fully functional.
So right now, Sheriff, with the border calming down, what would be job one in Pinal County? What are the priorities now?
Priorities now the borders calmed down, but under the last administration, they facilitated an invasion into this country. So the priorities now is all of these individuals that crossed the country and were not properly vetted, identifying those individuals, getting good information on them, and then getting them deported back to where they came from so that they're not victimizing the citizens of Pinal County.
Are ICE agents and Homeland Security, are they taking and removing people from your jails in Pinal County?
They have not. As of recently, we were a 287G jail. We've been 287G certified since 2006. Sheriff Vasquez, every sheriff since him has continued on with that process. So when we arrest an individual for any straight crimes or any municipality inside Pinal County arrest an individual, when they're booked into my jail, we have a detention officer that's 287G certified. What that means is they will run that individual through a federal database and see if they have any detainers or orders for deportation or any felony warrants for their arrest. And then that 287G certified detention officer will contact the feds and notify them of that.
I think people assume that you're rounding up people on the street, but most of the people deported are coming out of the jails. That's kind of the low-hanging fruit, right?
And it's people that are already committing criminal offenses. There's no one that's booked into the Pinal County Jail since Donald Trump became president that is booked into the Pinal County Jail or any of the other 14 county jails in Arizona that haven't committed an Arizona state crime or a city ordinance. But they are arrested on state crimes by the Pinal County Sheriff's Office or one of the cities inside Pinal County. And then once they're in our jail for committing criminal acts on American soil, then they're run through a program that says, hey, by the way, this person has a federal warrant for the rest.
Does it matter if they're convicted of the offense or just being picked up is enough?
Just being picked up is enough. If it's an offense that rises to the level that they're going to be booked into our jail, they're going to be run through that federal database system.
Okay. You guys in Pinal County are one of several counties around the country now using AI bots to lure criminals online. How is that working out? And I know it's a bit of it's expensive. It's $360,000 a year. But this is AI kind of doing sleuth work on the internet, posing as people or trying to ensnare predators. How's that working?
Well, I ran for sheriff because I believe in the PCSO family, and I want to protect every single employee, just like I will protect every single citizen of Pinal County. And this is the thing I like people to think about. Prior to using AI, and still currently using AI, we have to have detectives. Every agency has detectives that have to act like they're children and converse with predators online and have to listen to the horrible thing these predators want to do to children. And you have to do it in a manner that engages those individuals so that they want to continue on with the conversation. There's nobody out here that doesn't realize that that causes an emotional toll on those detectives when they do that. That's why there's time limitations placed on how long they can actually do that, because over time that emotional baggage becomes so great that it can affect them both personally and professionally.
Have you gotten arrests out of it?
No, not yet. Not any.
But you think that's coming?
Yes, sir.
360,000. Since you're the sheriff, you could probably hire 4 deputies for that?
Yep, about that, yeah.
Would you rather spend the money there than on AI bots trolling the internet?
I would rather attempt to use new technology that might assist law enforcement in the future and free them up so they could go back out and patrol than not just locking the door on technology and saying maybe this will work or maybe it doesn't work, but I don't want to find out. We're needing to move forward with things. Let's try something out. Let's see if it works. If it doesn't, fine. At least we gave it an opportunity.
Okay. You followed a tough act with Sheriff Lamb. Very popular, kind of a bigger than life figure. How would you describe to the residents of Pinal County and the other people watching tonight how your approach may be different?
Mark Lamb asked me to run for sheriff. If you don't know, Mark Lamb contemplated running for Senate. I think he should have won. But he contemplated about running for Senate. He had done such a great job of making the sheriff's office better over the 8 years that his tenure was here, that his biggest concern was not running for Senate. It was leaving the sheriff's office in the wrong hands. And so he's the one that asked me to run for sheriff. So the way I could describe it to people, and I wish this joke wasn't that funny, is I'm the shorter, uglier version of Mark Lamb. He will tell you if he was here, because he says it on almost every event that we're at, that if there's any way for a sheriff to be more Second Amendment than he is, that would be me.
Well, I appreciate your time.
That's a nice way to end it, Sheriff. Sheriff, thank you very much. Ross Teeple, Pinal County, continued success down there. I know it's a big job. Thank you.
Thank you, kind sir.
Good to see you. Thank you, Sheriff. When we come back, former state health director Will Humble on a new strain of COVID. Should we be worried about it? And the future of vaccines under HHS Director RFK Jr. when we come back on Newsmaker. Welcome back on Newsmaker. A new strain of COVID out there. Will Humble was the director of the Arizona Department of Health Services 2009 to 2015, now the executive director for the Arizona Public Health Association. So Will, COVID NB 1.8.1. Could we come up with a little pithier, catchier name if we're going to do this?
How about much ado about nothing? How does that sound?
Well, that's interesting. Okay, because we're not talking about it much, but there is a new strain out there. Is this anything to worry about?
No. I mean, I have, in fact, my 30-year-old daughter a couple days ago said, "Dad, have you heard about this new strain? It's like eating glass, if you get infected with it." I said, "What's the source of your information?" I asked her. "Well, I sent it to my Instagram feed." And I'm like, let me go into a little bit more detail and figure out what the WHO and some other European governments are saying about this. And the deeper I dove into it, the more it looked like it was mostly hype, I think, by influencers trying to get clicks. I mean, it is it's a new version of the Omicron variant.
Omicron.
That's true.
Okay.
Yeah, it's still part of Omicron. It's in the Omicron family, like it has been for the last few years. And it has a slightly different clinical presentation, meaning, slightly different symptoms, but it is not hospitalizing people at higher rates. It's not more dangerous. And so I think the take-home message to viewers is, look at the source of your information before you believe something, because there's no shortage of people who are willing to put out stuff just to get clicks, and then it scares people. And by the way, it's a disservice to the public health field, because when we do want to have a call to action for people and say, hey, this is something that's important, you need to do something, people get jaded when they start to see false evidence that's propagated. And I believe that's been the case with this newest variant.
Will, I always felt like you were playing it awfully straight with us on COVID. If it was bad, you told us that. If it wasn't, if we were in a lull, you told us that. Upon reflection now, how do you think public health was harmed by the way this was handled and kind of the aftermath of people being skeptical now of science?
I agree. I think the politicization globally, not just in the U.S., of the COVID-19 pandemic and the resistance that people had to some of the basic interventions like, widespread masking in indoor closed environments. And then I think that built up resistance among people who just simply did not believe it or didn't want to believe it. And that was amplified and reinforced by politicians who, I believe, felt like it was in their own best interest to reinforce, the negative parts of, or the resistance to, the public health recommendations. I think it's had maybe even a permanent harm to the public health field and public health generally. And quite honestly, I have to say, I see it being played out right now with Secretary Kennedy and some of his decisions, like, for example, his decision last week to no longer recommend the COVID-19 update vaccines every fall. That means anyone under 65 who doesn't have chronic medical conditions is probably going to have to pay for the vaccine on their own. The health plans aren't going to pay for it anymore.
I was going to bring up RFK because I think if you kind of decode where he's at, he's saying, look, if you want to do a vaccine, do it, but know about it, do your research, talk to your doctor. He's kind of saying we shouldn't be foisting this stuff on people. Do you think that's a prudent way forward or not?
I don't think that's what he's doing. I mean, what basically they did is that the CDC no longer recommends the annual COVID vaccine for anyone under 65 unless they have chronic medical conditions. The practical impact of that is that health plans are no longer going to cover it. So it does remove, it really basically removes the choice that people have. Like, look, I'm under 65. I want to get the vaccine, not just to protect myself, but because I have elderly parents. I don't want to spread it to them or others in the community. You're going to have to pay cash for that vaccine now. So it's more than what you just said.
Okay, that's a very, and that is in my notes, actually. that health
this
companies,
is
health
taking away the
insurers.
choice, or else, find somebody to give you the vaccine, but you're going to have to pay $220.
Okay, so what you're saying is, what the upshot of it is that fewer people really will have a choice if it's between paying the heating bill and getting a COVID shot.
That's correct.
That's the practicality on the ground.
That's right. And remember, we talked about this during COVID. There's two purposes for a vaccine. Number one, it's the protection that it provides me, right? That every individual who gets the vaccine, it protects them. But the side effect is, and equally important, is that the vaccines that the community get slow down the amplification of the virus, slow down the spread generally with herd immunity. It's not really herd immunity, but it mitigates the spread of the virus so that the higher risk people are less likely to come in contact with the virus.
That was the predicate of the whole thing.
Benefit is going to be lost by this policy.
That was the predicate of the whole thing. Get everybody inoculated. But what's so interesting is, and I want you to comment on it, I think of Sweden that had a far better outcome than we did, and they did a heck of a lot less. They let herd immunity, natural herd immunity, win the day.
They let people get infected, and it ran its course. I am not familiar with the demographics and say, for example, U.S. isn't Sweden. Obesity is a much bigger problem in the U.S. than it is in Sweden. I don't know about the age demographics of that country. So all of those things played into how damaging this virus was. Take, for example, what continent did fantastic during COVID? Africa. Why? Because the median age is like 20 there.
Yeah.
So you take an aging population, it's far different from a very young population.
That's a great point. Kennedy also terminated a $700 million contract with Moderna for its bird flu vaccine. He is so skeptical of big pharma, and it is wild to have someone like that in the upper echelons of government. There is definitely a war going on right now between big pharma and this administration. They are pushing hard, and they're saying, you're foisting this stuff on us, and we're not thoroughly convinced that it's all for the good.
Skepticism is healthy both in public health and, administering large programs. You don't want to believe something just because it's said. You look at the evidence. And my biggest problem with Mr. Kennedy has been that for decades now, he forms his opinions not based on evidence, but from things that he has heard. A lot of times it's anecdotal. And that's fine when you're, a lawyer trying to make a living doing one thing and another, but it's a completely different thing when you have the power of the state. And that's what he has now. He has the power of the state, and he's using that power to using his opinions that are not evidence-based by and large. And that's a huge problem when it comes to having the power of the state in charge of all those agencies, FDA, CDC, National Institutes of Health, and then not having the frame of mind that evidence should drive your decision making. Look, you can be a lawyer and a good HHS secretary. You don't need to be a doctor or even a public health person, but you do have to believe in evidence-based decision making. And I don't believe that Mr. Kennedy does.
That's so interesting. Do you think that we are at a point, we've got about 20 seconds, where people are skeptical now of the health experts?
Yes, and not just the health experts. It's, they're skeptical of institutions generally, including health institutions. Yeah, it's sad, and it's true. You're
and
right.
The media.
And the media.
Well, it's well deserved.
Make sure if you're going to believe something, make sure it's a media outlet that has editorial review, so that it's not just influencers, but people who are actually held accountable to the things that they present.
Will Humble, thank you so much. It's great to see you again from God's country in Iowa.
That's right.
Yeah, I appreciate you taking the time, Will, out of your vacation, and enjoy the summer, and we'll talk soon.
All right, good to see you, John. Great
to see you. Will Humble. We're back in a moment on Newsmaker. Thanks as always for joining us, and we will see you next week on Newsmaker.